What's up, future nurses? Dr. Mike here, dropping some knowledge bombs to help you conquer the NCLEX. We're tackling a topic that's crucial for patient care and, let's be real, often pops up on exams, fluid, and electrolytes. Understanding this stuff is key to providing top-notch care. We're talking about keeping your patients hydrated, their hearts beating right, and their muscles firing on all cylinders. We're going to break down this topic into bite-sized pieces, throw in some memory tricks, and have you feeling confident about acing those NCLEX questions. Let's do this. Alright, let's talk about why we even care about fluids and electrolytes. These guys are the MVPs of your body's internal game. Think of your body as a complex machine, like a well-oiled bicycle. Fluids are like the oil, keeping everything running smoothly, transporting nutrients, and removing waste products. Electrolytes are like the electricity that powers the whole thing. They're involved in everything from muscle contractions and nerve impulses, to regulating your heartbeat and keeping your blood pH balanced. Without the right balance of fluids and electrolytes, your body's symphony orchestra turns into a chaotic garage band. We're talking about patients experiencing weakness, confusion, irregular heartbeats, even seizures in severe cases. We need to be able to quickly identify the problem, understand the underlying cause, and provide the right interventions to get our patients back on track. By the end of this video, you'll be equipped with the knowledge and mnemonics to tackle any NCLEX question that comes your way. Let's break down electrolytes. Imagine them as tiny, electrically charged particles that are constantly buzzing around in your body's fluids. These electrical gradients are what allow your nerves to transmit signals, your muscles to contract, and your heart to beat in perfect rhythm. They also help regulate fluid balance and ensure your cells are getting the nutrients they need. Now, there are a whole bunch of electrolytes hanging out in your body, but we're going to focus on the VIPs: sodium, potassium, calcium, and magnesium. Each one has its own unique role to play, and they need to work together in perfect harmony to keep your body functioning at its best. But just like a basketball team can get thrown off their game by injuries or foul trouble, your electrolyte balance can be disrupted by a number of factors, like dehydration, certain medications, or underlying medical conditions. That's why it's so important for us nurses to be able to recognize the signs and symptoms of electrolyte imbalances and take swift action to correct them. Let's dive into the specifics. Time to meet the Electrolyte All-Stars: sodium, potassium, calcium, and magnesium. First up, we have sodium, the MVP of extracellular fluid. It's like the coach of the team, regulating fluid balance and keeping things running smoothly outside of your cells. Next, we have potassium, the star player inside your cells. It's all about muscle function and nerve impulses, making sure your heart beats strong and your reflexes are on point. Then there's calcium, the bone-building powerhouse. Calcium also plays a crucial role in muscle contractions and blood clotting. Last but not least, we have magnesium, the unsung hero. It's involved in over 300 enzymatic reactions in your body, supporting everything from muscle function and nerve transmission to blood sugar control. Remember, these electrolytes are a team, and they need to be in balance for your body to function properly. Chapter 4. Mnemonics to the rescue. Trying to remember the normal ranges for all these electrolytes can feel like trying to memorize the entire phone book. But fear not, future nurses. Mnemonics to the rescue. For sodium, think salty summer. The normal range for sodium is 135 to 145 micl. Picture yourself on a hot summer day sweating out all that salt. Potassium, think bananas for balance. The normal range for potassium is 3.5 to 5.0 micl. And what's rich in potassium? You guessed it, bananas. Calcium? Think call 911 for strong bones. The normal range for calcium is 9 to 11 mg/dl. Finally, for magnesium, think magnificent muscles working hard. The normal range for magnesium is 1.5 to 2.5 micl. Chapter 5. Spotting electrolyte imbalances. Now that you're familiar with the Electrolyte All-Stars, let's talk about what happens when their game gets thrown off. Electrolyte imbalances can manifest in a variety of ways, and it's our job as nurses to be able to spot the signs and symptoms. For example, low sodium levels, also known as hyponatremia, can lead to confusion, headache, and even seizures in severe cases. High potassium levels, or hyperkalemia, can cause muscle weakness, fatigue, and even life-threatening heart rhythm abnormalities. Low calcium levels, or hypocalcemia, can lead to muscle cramps, spasms, and even seizures. And low magnesium levels, or hypomagnesemia, can cause a whole host of problems, including muscle cramps, tremors, and even seizures. The key takeaway here is that electrolyte imbalances can present with a wide range of symptoms, from mild to life-threatening. Recognizing these signs early can make all the difference in patient outcomes. Let's move on to fluid balance. Chapter 6. The importance of fluid balance. Let's shift gears and talk about fluid balance, the other half of this dynamic duo. Fluids make up about 60% of your body weight and are essential for just about every bodily function. Your cells, tissues, and organs all need a constant supply of fluids to stay hydrated and function properly. Fluid intake comes from all the good stuff you drink and eat throughout the day, like water, juice, fruits, and vegetables. Fluid loss, on the other hand, happens through urine, sweat, breath, and even bowel movements. When this delicate balance is disrupted, it can lead to either dehydration or fluid overload. Both conditions can have serious consequences if left untreated, so it's crucial for us nurses to be able to recognize the signs and symptoms and intervene appropriately. Now let's talk about IV fluids. Chapter 7. Mastering IV fluids. Let's talk IV fluids, a cornerstone of nursing care and a topic that often pops up on the NCLEX. IV fluids are like the pit crew of the human body, rushing in to replenish fluids and electrolytes when things get out of whack. For isotonic solutions like normal saline, which is 0.9% nacelle, and lactated ringers or LR, think, stay where I put it. These fluids have the same concentration of solutes as your blood, so they stay put in the intravascular space, helping to increase blood volume. For hypotonic solutions like 0.45% NaCl, think hippopotamus in the river. These fluids have a lower concentration of solutes than your blood, so they cause water to move into your cells, swelling them up like a hippopotamus in a river. And for hypertonic solutions like 3% NaCl, think hyperkids shrink. These fluids have a higher concentration of solutes than your blood, so they draw water out of your cells, shrinking them like a hyperactive kid who's been told to calm down. Now let's bring all this knowledge together and see how it plays out in real-world nursing scenarios. Imagine you're working in the ER, and a patient comes in complaining of severe vomiting and diarrhea for the past few days. This patient has lost a significant amount of fluids and electrolytes through vomiting and diarrhea, and their body is struggling to keep up. You'd expect to see signs of dehydration like dry mucous membranes, decreased skin turgor, and low blood pressure. You'd also want to check their electrolyte levels, as they're likely to be out of whack. Or let's say you're caring for a patient with congestive heart failure, a condition that can lead to fluid overload. This patient's heart isn't pumping efficiently, which can cause fluid to back up in the lungs and other parts of the body. You'd be on the lookout for signs of fluid overload, like swelling in the legs and ankles, shortness of breath, and high blood pressure. Monitoring their electrolyte levels is crucial, as fluid imbalances can affect electrolyte balance. Now, let's talk strategy for conquering those NCLEX questions on fluid and electrolytes. Remember, the NCLEX is all about testing your critical thinking skills and ability to apply your knowledge to real-world scenarios. First and foremost, read the question carefully and identify the key pieces of information. What's the patient's presentation? What are their vital signs? What are their lab values? Once you have a good understanding of the situation, consider the possible nursing interventions. What would you do to assess, monitor, and manage the patient's condition? Remember, the NCLEX loves to test your ability to prioritize care. Focus on the big picture, apply your knowledge, and trust your gut instinct. Let's recap the key takeaways from today's fluid and electrolyte crash course. We covered a lot of ground, so pat yourselves on the back for sticking with it. Remember, fluids and electrolytes are essential for maintaining the body's internal balance and keeping everything running smoothly. We talked about the major electrolytes, their normal ranges, and the signs and symptoms of imbalances. We also discussed fluid balance, IV fluids, and how to spot and manage fluid and electrolyte imbalances in real-world nursing scenarios. But here's the thing about nursing. It's not just about memorizing facts, it's about understanding the why behind the what, and being able to apply your knowledge to provide safe and effective patient care. Practice what you've learned. That's a wrap on fluids and electrolytes. I hope you found this crash course helpful and maybe even a little bit fun. Remember, mastering this topic is crucial for your NCLEX success, and more importantly, for providing top-notch patient care. Now, I know studying for the NCLEX can feel like an uphill battle, but trust me, you got this. Just remember to break down complex topics into manageable chunks, use mnemonics to your advantage, and practice, practice, practice. And hey, if you ever need a dose of medical knowledge or just want to hang out with your favorite doctor, you know where to find me. Until next time, stay hydrated, stay curious, and keep crushing it. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more nursing tips and tricks.